Good morning, everyone, and welcome to the Thursday, September 2nd, COVID-19 Response Media Briefing. I'm Julie Grauert, and I'll be your facilitator for this event. Thank you again for your patience as we were working out some audio issues. I'd like to welcome our panel for today. It is a stacked one. From the Washington State Department of Health, we have Dr. Umair A. Shah, our Secretary of Health, Dr. Scott Lindquist, our Acting Chief Science Officer, Michelle Roberts, our Acting Assistant Secretary, Nate Weed, our Acting Deputy Secretary for Emergency Preparedness, Resilience, and Response, and Amanda Geffro, our COVID-19 Guidance and External Affairs Lead. Also joining us today is Dr. Michaela Miller, Deputy Superintendent from the Office of the Superintendent of Public Instruction. To begin today's briefing, we will open with remarks from Secretary Shah. Go ahead.
Good morning. Julie, can you hear me okay?
Yes, we can hear you.
All right. Well, good morning, everybody. I want to just start by thanking everybody for joining us again today. I also want to start by thanking our guest, Michaela Miller, Dr. Miller, for joining us. She has been, she and Superintendent Rickdahl have been very close partners of ours, and I really just want to thank them for that incredible partnership. This has been a very difficult time for all of us, so I do appreciate public health and education working together. Good morning to all Washingtonians. I know many across Washington are doing their best to get ready for the school year and or have already started getting their kids ready to start the school year. And I'm going to be, I'll be honest, I'm one of those parents. And so we have two kids who are starting the school year in just a few days, and we've got all sorts of questions and concerns, but also excitement. And there's, you know, let's make sure we get our school supplies and all sorts of questions like that that are swirling in our household right now. So given what is on a lot of people's minds today, we are going to focus this briefing on back to school, returning to school, and really spending a lot of our time talking about that in-person learning. But we also know that you may have questions about where we are with the pandemic, where we are with cases, transmission, and where we are with the Delta variant, as well as what's happening in our healthcare system. And that's why you have a number of team members that are on the call there. Dr. Lindquist and I and Dr. Miller are going to be primary speakers, but you see our additional team members who are here for questions, answers, and obviously if I say something incorrectly, they're there to correct me. Before I start, I did want to take a big picture look at what's going on elsewhere. As you know, last week we mentioned the situation in Afghanistan. We continue to monitor this very closely, and we're also monitoring what's happening in terms of an impact on the state of Washington, including with respect to refugee arrivals. I just wanted to let you all know that Department of Health remains ready, along with other state agencies, to welcome refugees that come into the state, and also make sure that we work together on their health and well-being as they come into our state as well. I also want to take a moment to reflect on Hurricane Ida. As you know, I hail from Texas, and I've been through multiple storms, multiple hurricanes, and most recently Hurricane Harvey. And I will tell you, it is not an easy time for those who have been impacted, both in Louisiana, New Orleans especially, but into other states. And as you see now, moving into New York or in the East Coast, there has been this incredible impact from this storm. And we want to do everything we can to be supportive, offer our well wishes, our prayers, and to our friends and colleagues that are down there, but also encourage anyone who can offer assistance to consider doing so. Usually in these kind of situations, it's more whether it's financial or other kinds of assistance, like dried goods or other materials. I would really ask you to touch base with those who know what's happening on the ground and be able to help them during this very difficult time. time. Now let me turn to schools. I will be speaking today as you know, as Secretary of Health, as a physician, but also as a parent. And as you know, my wife and I have 3 children. The oldest and middle one are both school age ready. I'm not sure they're school ready, they're school age ready. And we also have our youngest, who is 4 years old, so not quite there. We are going through what other parents are going through right now across not just Washington, but I want to make sure everybody recognizes across the country. This is a time that is challenging for all of us, and we want to help reassure parents, educators, and especially the kids on what's being done to have a successful school year in the midst of a pandemic. And that is something that obviously all of us are very mindful of. We recognize that we're in a difficult moment for all of us, and we also recognize that Washington schools have the structure as well as the processes and the protocols and the people to have successful education in person. All K through 12 schools, public and private, as you know, are required to implement layered safety measures to prevent the spread of COVID-19. Dr. Miller is going to be speaking about that. And I did want to mention that the first of these really do start with vaccinations. Vaccines are required for all staff, as you know, by October 18th. And the good news is many staff have already been vaccinated, and this is absolutely protective for not just the staff member and those around the staff member, but especially the students and the kids who are going back to school. We strongly recommend, although it's not required, as you know, for students, we strongly recommend that any child age 12 and older get vaccinated as soon as possible to help protect themselves and their classmates as we go back. And if I can ask our team to show, okay, well, we've got this. Thank you for the school bus. I love the school bus visual here. And I will just say that, you know, vaccines are the top of this, but next does come masks. And as we know, they're very good at limiting transmission. And that is why I signed the Secretary order last week for masking indoors. But as you know, we're also requiring masking K through 12 to limit transmission. And we know that the studies of schools in other states show that when masks are worn uniformly by students and staff, even in areas of high community transmission, the schools remain protected, and it is important for us to have that real universal masking in schools as well. The other layered measure includes ventilation, and this is maximizing air circulation in buildings, going outside as much as possible, opening windows. And, you know, we even encourage schools where they can, while the weather is still nice, to be able to even have kids outside, whether it's during cafeteria time, whether it's a time to be able to do a philosophy class outside, or whatever it is that a teacher is able to take that set of students outside in the courtyard or the recess area or the playground. This is the time to be able to do that before the weather gets harder to be able to take kids outside. We also recommend, as you know, hand hygiene. That includes everything from hand sanitizers and making sure that the bathrooms are there and clean, but also for parents and teachers alike, that when either the child or the educator is sick, that they stay home, and that we do everything we can to have good cleaning practices back in the school, but also we do everything to check for symptoms for every day for kids and for teachers. And we'll be we want to make sure that kids who are sick or adults who are sick are not going into a congregate setting and getting others sick as well. So why is that important? Because of what's next on this list, which is if there are symptoms, we absolutely want to have those with those symptoms get tested. Schools have a great resource for testing on campus, and Amanda Amanda on our team she and her team members have done a fantastic job with our Department of Health Learn to Return testing program, which provides a menu of options for school districts. Obviously, schools can choose what testing program is right for them. But the good news is that most districts in Washington are currently enrolled statewide. And that's really very, very good news for all parents. And if your schools or school districts have not enrolled, I would encourage obviously them to do so. It's not too late to do so. And parents can also ask their schools about whether they are participating and how they're implementing those program based information. Schools will be following the CDC guidance of 3 to 6 foot distancing. If we could put that back up, Julie. The social distancing, physical distancing pieces remains critical, and we want to make sure that we have that in place as another additional important layered effect. Finally, the last piece is to make sure both the school and you as a parent have a plan for when cases happen. We do know that there will be some cases across the state of Washington, and we want to make sure that schools are appropriately responding to those cases along with their public health partners and health partners on the ground, but also that families are ready to respond as well. And this allows me to segue, but before I segue, I want to make sure that you see this together. The layered safety measures include vaccines, masks, ventilation, again, taking outside where you can, hand hygiene, making sure that if you're sick or anybody that's sick, that they not come to school and avoid getting others sick, the importance of testing, physical distancing, and having a response plan that's already in place, but also parents being ready for what they're going to do if they had to, if there was a need to bring their child home. And that means making arrangements with work or making arrangements with neighbors or family members to be able to watch your child if you're not able to watch your child, et cetera. So these are really important things that we want to make sure that everybody is thinking about. Now, moving forward, Department of Health, our department, as well as OSPI, in partnership are going to be releasing updated school-related guidance this coming week, next week, right after Labor Day. One is an update to the school requirements document to align with the updates, as I mentioned, to the Secretary's face covering order, as well as the governor's vaccine requirements. The other is a best practices document to guide schools. This is going to supplement the health and safety requirements that have already been put in place. This resource is more detailed information on how to implement required measures and includes additional protective measures that schools can take and also parents can be aware of. For example, it outlines how testing can be utilized as an additional tool and how to set up procedures for quickly responding to cases of COVID-19. Our goal with this new guidance, as you can imagine, has been the goal since we made the announcement this past year, which is keeping schools open for in-person education. These provide additional tools and resources that schools and local public health have been asking for and helping to develop. And as you know, we're always reviewing our data, the science, the environment, changing guidance at the federal level, information we're getting from other countries as well as across the country here, and the environment here locally to inform updates to our guidance and tools. And we know that at times these updates are necessary, precipitated by recent changes, which includes obviously our broader policies regarding masks and vaccines. But we want to make sure that we're taking the necessary steps and our schools are taking the necessary steps and our parents are taking the necessary steps during the school year ahead to give us the best chance of keeping schools open and both kids and adults protected. I think that's the key message today. So from a health perspective, we know that in-person learning is tremendously beneficial to children's overall well-being and their development. That's the reason that we're working so tirelessly with our partners across the system to make sure that kids can go back to in-person learning. We know there are behavioral health impacts and social and emotional isolation of kids from their peers during COVID-19, and that has been significant. I will tell you, I see that in my kids every single day. It has been really tough, not to mention just not seeing, your kids being as active, running around or doing things that's more structured. It's been really challenging for all parents. We know without in-person interaction, it becomes even more difficult to assure the equitable access to not just education, but identifying learning delays, behavioral health issues, and other safety issues that children may be facing. And we know that's absolutely critical as well. This isn't just about COVID-19, it's about the whole spectrum of health, and we want to make sure we're focusing on that, especially for our kids. The work we do now, keep them safe, will in the long term help ensure a brighter and healthier future, not just for our kids, but for all of us. And we know that some are absolutely concerned, given that the Delta variant is more transmissible, given what we're going to be showing about data. And as we get children and teachers back into school, we all play a role. We have to work together for the best possible outcome. So what does that mean? That means if you're a parent, talk to your child. Let them know what health behaviors you expect from them, what you want them to follow, even if Johnny or Susie in the classroom or at the playground isn't following those behaviors. It's important to remind them of see something, say something. If they see something that's not right, that they tell an adult, that they tell a teacher, that they do everything they can to stay protected as well. If there is something that doesn't feel right, that they are also making sure that they let a teacher or an adult know. And as a parent, talk to your school, let them know you care, that you are supportive. This has been really tremendously difficult for parents across the spectrum. We do not want to see the challenges of people arguing and fighting. We want it to be a supportive environment. Please do what you can to be part of the solution, to talk to your school and know what plans they have in place and be able to support them in the success of those plans. Educate yourself on good health information. Please educate yourself on good, reliable, accurate health information, and take a breath. You have worked really hard making sure your family, you and your child are safe throughout this pandemic, and that approach will absolutely be necessary to ensure your child and your family remain safe as we move through the school year. So what can families do? And thank you, Julie, for putting this up. Families can help outside of school time. We all know that it's not just about what happens during those school hours. It's what happens prior to getting to school, what happens after kids leave school. It's what happens on weekends and what happens on holidays. We want to really reduce the spread of COVID-19, not just amongst children, amongst families, amongst neighbors, amongst everyone involved. So what does that mean? Again, first of all, first message, vaccinate. Don't hesitate, vaccinate. It is so critical that if you have not gotten vaccinated yet, this message is there for you. This Delta variant is not been easy to fight, and those who are unvaccinated are markedly more, we've shown previously, 10 to 20 times more likely to be unprotected and hospitalized. We want to do everything we can to get those who are eligible for vaccines in the state of Washington to be vaccinated. So that's important. Limit travel and large crowded events. We know a lot of events have been canceled or they've been modified, but those events that are continuing, even if they're continuing, there's not a requirement to wear a mask outdoors at those events. Please make sure you take a mask with you. And when you feel that there is something not right, you go ahead and put that mask on, you slip it up, and you go ahead and protect yourself. And especially, here's the key message, you also have the masks and the and the ability to protect your family members who are also out with you. So it's not just what happens within the school grounds and on the school grounds, it's also what's happening in advance of and after. And that's a good reminder for Labor Day. We know Labor Day is coming up this weekend. We know a lot of people have travel plans. A lot of people have plans to just get outdoors or do things with them, with their family members or with friends. We want to make sure that they're safe. If you don't have to travel, don't travel. And we're actually saying to people, please avoid large crowds. Absolutely wearing masks anytime you're indoors, and as I mentioned, around people from outside of your household, and certainly even in crowded settings outdoors is important. And really, again, the key message is if you're have symptoms or you're concerned that you may have been exposed to somebody with COVID-19, get tested. You can't trace without a case. Testing is critical. It remains a critical piece of our response. So this is a difficult time for all of us in Washington, just as the last 18 months plus have been. But we can and will work together. And when we work together, we can and will have a successful school year. We really want to do everything we can to provide that guidance, and working with OSPI and our partners, governor's office, and all throughout our communities. We know we can do this. And I want to thank everybody who's been involved in that. So with that, let me turn just for, if it's just okay to show, actually I want to show two quick slides. The first slide, can you pull up the vaccination numbers for the, do we have it at 12 and above? I believe. $16 and above. Here we go. So as of August 30th, as you can see, 41% of our kids who are 12 to 15 years of age are fully vaccinated, and just under half of people who are 16, 17 years of age or adolescents are fully vaccinated. So that's great news. We've been really emphasizing this for the last several months, since vaccines eligibility had decreased to younger age groups. But as you can see, we still have work to do. So if your child is in that 12 to 15, that 16 to 17 or above, or you are above that age in that eligibility, and you have not gotten vaccinated, we would recommend, and we would encourage, and we would strongly recommend and encourage that you not hesitate. You vaccinate today, you get your child vaccinated. Please set up that appointment, because that's going to be critical to the success of not just your child, your family, but also those around you. And if I can show the last slide, which is around where we are with our cases. So I am going to just briefly touch on this, and then I am going to turn this over to Dr. Lindquist. In fact, you can leave this slide up as Dr. Lindquist takes the mic. So as you can see, we are still in the midst of our fifth wave. And as you remember, we had the early part of March, April last year, then we had the summer of last year, and then we had a protracted sawtooth pattern during the winter months, and then things got better. In April, we had a slight uptick, our fourth wave, which felt very difficult, but it was nothing compared to what we're seeing right now. What we're seeing right now is increases in cases across the community, and that also, and we have Nate Weed on, that also spills into our healthcare system. And we are absolutely monitoring this, and we're very concerned about this. This fifth wave is important for a number of reasons. One, because it's largely been driven by those who are unvaccinated. It's also now, we're seeing it's being driven by the Delta variant, and Dr. Lindquist will talk about that. And also, it's really important to say that we are seeing people that are getting hospitalized, and people that are getting hospitalized from COVID-19 is now on top of what else we're seeing in the system. And so that means that it's also those who are having heart attacks or strokes, going into the healthcare system. But in addition to that, it's people who have delayed care. We do not want people to delay care, but our healthcare system, as I mentioned last week, is stressed, it's strained, and it's stretched. And staff shortages, the 5 S's here, are really very key to what's happening. But as Dr. Lindquist will show and talk about, there is some hopeful news at the end of this, where we're hoping that we're starting to see some flattening of cases, and hopefully soon even in the hospital system. So that is hopeful news, but obviously we are still in the midst of this 5th wave. And so we want to encourage everybody to get vaccinated, and certainly want to encourage everybody to wear masks. And we also want to make sure people are avoiding those behaviors that may get them in trouble or those around them in trouble from a COVID standpoint. So with that, thank you so much. And Scott, I'm going to turn it over to you, and we can leave the slide up for you. Thank you.
Great, thanks. And Julie, you can hear me okay?
Yes, I can.
Okay, so Dr. Shaw gave a great overview of where we're at with our cases. What we know is we've been at the top of these peaks before. We know what to expect in that gray area of the graph all the way to the right here, where the cases aren't complete, the information isn't done, but what we are seeing is the steep rise has looked like it's slowing down. You can see that for yourself here. That is the hope we have for a plateau in the number of cases. But the other point, of course, is this wave, this 5th wave, is as high, if not higher, than any of the previous waves. But that is the good news, is that the sharp increase is slowing down, and we're hoping this is going to signal a plateau. The concern, though, is this plateau in cases usually precedes the hospitalization plateau by 1 to 2 weeks. So that means we've got at least, at best case scenario, 1 to 2 weeks of increased hospitalizations. And that's exactly what we're seeing. We're seeing hospitalization rates at numbers we have never seen before. And as many of you know, it's taxing the healthcare system. We'll, if you have any questions about this, we again have the head of our emergency preparedness on that can talk about what the situation in the state looks like. And then the last thing is death rates. Our number of deaths have actually remained fairly low. There is a small bump in those numbers, but again, that lags behind the total number of cases, but thankfully it remains lower. So our death rates are lower. So again, high case rates, high hospitalization rates, and our death rates remain stable. The last thing that I want to just touch on is about breakthrough cases. And we know, many of you have pointed out to us on this call that we're not capturing all of those breakthrough cases. And again, it's a very passive system for having a healthcare provider report to us a person who's developed disease, test positive. We go back and verify, did they have full dose of vaccination? Has it been at least 2 weeks? And then we calculate those. And that is very passive. So we have been working with the CDC and the national organizations about having Washington be a pilot for a much more aggressive case finding for breakthroughs. And that is what we call an active surveillance system, where we're actually looking at all case positive reported results and then matching that against immunization status and determining a breakthrough. And a report was just posted on the DOH website last evening, which shows that our breakthrough cases still remain in the area that we expect them. We expect to have around 1% or less of all of the vaccinated folks to have breakthrough. And that is truly what our new, very active system. I'm just happy to announce that we have improved ability to monitor breakthroughs. You will see that the numbers increase quite a bit due to the new methodologies and also due to an increase in breakthrough cases with this Delta variant. But I'm happy to say we're in a much better position now counting these breakthroughs than we were a month ago. And that just leaves to talk about the variant, which it's pretty easy at this point. Over 98% of all our variants are being identified as the Delta variant. It is very fascinating to me that this variant is so outcompeting the other variants that it'll be interesting to see if we get any new variants over time, but clearly right now, driving the cases, driving the hospitalizations are these Delta variants. And with that last word about as a pediatrician, so I'm still a practicing pediatrician. I have seen over the year and a half of this pandemic, the effect it's had on our kids, the effect it's had on the families, and Dr. Shaw outlined this very well for the mental health, drug and alcohol, behavioral health, and physical health aspects of not being in school. So again, as a pediatrician, this is a common question from parents is, what would you do if you had kids? And I do have 3 kids, and they're all in school at this point. They're at college level, but I do recommend that our kids go back to school. The risk is there. It's not zero, but it's being mitigated with all these structures and the layered structures that Dr. Shaw outlined for you. But again, it's a lot like, if many of you haven't been through this, when you get your child to start driving. So when they turn 16 and they're going to drive a car, there's clearly driving a car is not a safe thing to do. You can mitigate that risk with safety measures like seat belts, taking driver's education course, not driving at night, not doing long distance, not having others your age in the car until you're past a milestone. All these things are ways to mitigate that risk. It's very, very clear to me. It feels like when I put all 3 of my kids behind the wheel, how I was worried as a parent, how I understand the risk, but I also understand the benefit. And I think that's where we're at right now with kids going back to school. I understand that risk, but the benefit so outweighs the risk and the things we can do to help mitigate that, as previously talked about, that it's time. It's time to get our kids back to school. And with that, I turn it back to you, Julie.
Thank you, Dr. Lindquist. Our final panelist will be Dr. Miller. Go ahead.
All right, thank you. And thanks to Dr. Lindquist, Dr. Shaw, the whole team at DOH. As Dr. Shaw mentioned, we've been joined at the hip, OSPI and DOH for the last 18, 19, I don't even know how many months it is. And just want to thank the whole team over there for being consistent with our communication. I come to you too as the deputy superintendent here at OSPI, but also as a mom and a parent of 2 school-age kids. And so I too am facing the same questions and concerns that others out there are, sending my boys back to school. We know that schools are the heart of a community. And so it takes the community to reciprocate the kinds of safety measures that are in place. And that's really an important piece. Schools don't work autonomously. They work in conjunction with the community that they're in. And so that reciprocal nature of safety and health of our students is really dependent on the communities that take on those same attitudes and pervasive use of health mitigation, layered mitigation. So that's really an important component to this in order to start and continue in-person learning. We have about 1/3 to half of all of our students that have already started in-person learning for the year. So our school districts across the state begin the school year over about a 3-week period. So many students are already back learning in person now, and we kind of complete that going back to school next week. So by the end of next week, we will have all 1.1 million students in the system back in some way, back in person or in some online option that has been afforded by the school district. We learned a lot over the last year. Schools have implemented the measures that were already outlined by Dr. Shaw with fidelity over the course of last year: face coverings, ventilation, physical distancing, hand washing, all of the mitigations, layered mitigation strategies our educators are experts at now. They know what to do. Our students know what to do. Families can help with these safety measures by modeling those practices outside of the school setting. That is probably the most important thing. We know that in any situation, modeling those best practices for your students is going to be probably the most paramount thing you can do. So if they're masking in school, when they're masking in school, masking in large situations outside of school, congregate settings is going to be really, really important. Many students, families, staff are adjusting to this in-person situation over the course of the spring. All schools came back in some form of in-person learning over the April and May and June. And now we're starting with not a completely normal school year by any stretch, but it is looking more normal than we have ever had it before. You can reassure students, families, work with your school districts, ask lots of questions. As Dr. Shaw pointed out, that communication with accurate information is the key to making this a successful school year. Finally, our state, through federal funds, have invested millions and millions of dollars into both health and safety mitigation strategies, but also increased support for behavioral, mental health, social emotional learning, and as well, most importantly, the academic component of school. So we have invested through federal ESSER funds, both here at the state agency, but also directly to school districts, funds that are going to help them, support them throughout the year as they adjust to this new normal. And then finally, I won't repeat all of the things. We have two really key measures that have to be considered as we move forward. We have vaccines. We did not have those ubiquitously across the state in every school district. We were vaccinating our teachers towards the end of the year. The vaccinations for students came on really at the tail end of last year. And we also have a more robust testing program across the state, Learn to Return. So we have two new layered mitigation strategies really that are available for 12 and over for vaccines. Staff obviously are required to be vaccinated by October 18th. And we have a new testing system with additional funding that will help both with families feel more reassured that there's yet another layered mitigation strategy at our disposal, as well as vaccinating those that are eligible 12 and over. Finally, I would just really ask everyone, and I personally do this every day, please thank an educator, a school bus driver, a school administrator, a district administrator, a custodian, anyone within a school. They are working very hard to ensure that not only we get back to in-person learning, but that we maintain in-person learning. And again, that will take this community effort. Schools are the heart and soul of our communities. And so we need to help them by doing everything we can to make sure that they maintain that in-person accessibility for all students.
Thank you so much, Dr. Miller. This brings us to the question and answer segment of today's briefing. We have about 18 minutes left in the briefing and 8 reporters in the queue. We will begin with Jessamine from Q13. Go ahead.
Good morning, and thank you all so much for your time. I appreciate the emphasis on education and return to in-person, because that's what I wanted to ask about. Unfortunately, we're looking at, according to the latest numbers on the DOH website, over 20 pediatric deaths in the state. And those were occurring before the return to in-person learning just yesterday. At what point would you recommend returning to remote learning? And I know the importance of in-person. And furthermore, returning to higher restrictions in our state for those who aren't in school. And secondly, with 40 Washington superintendents opposing what they call the one-size-fits-all COVID protocol, we could essentially be looking at a free-for-all as schools self-regulate. So how can you mitigate that?
Jasmine, thanks. I'm going to take a beginning set of comments to that, and then Dr. Lindquist and Dr. Miller, I'm sure will have some additional thoughts here. Maybe Amanda does as well. The way I would say it is that, first of all, we do agree with. Oops, sorry, I somehow hit mute there, so apologies for that. I don't know what part I said or didn't say, but let me just start over that Dr. Lindquist and Dr. Miller may have a comment, and Amanda may as well. First of all, we do agree with the notion, first to open, last to close. I mean, right now, the reason we say the in-person is because of all the reasons that we have outlined, and not just the reasons for the benefits, as Dr. Lindquist mentioned, Dr. Miller also alluded to students, but also the layered protection that's in place. And so, yes, we do know that kids can get sick from COVID-19 just as adults can, and just as every age group. And this is why this is a global pandemic, that it doesn't matter who you are, where you live, where you're from, what you look like, what you believe in, that this is an equal opportunity ready to take you on virus. And that means that we have to be very careful with what we do. We do feel that comfortable with the fact that we have put in place, and we will continue to update, by the way, put in place the guidance that's going to allow for schools to be successful for in-person learning. Now, does that mean that we're not going to have a case here, or we're not going to have a number of cases there? That does not mean that. We, in fact, should be on the lookout for that, because any time during this pandemic you've had people coming together, there is a potential for transmission. That is absolutely the case. But masks work, vaccines work, distancing works, protocols work, and people championing the right, credible information works. And that's what's been really missing in this whole piece, is everybody being together and making sure that we are successful in assuring that our kids can go back to in-person schooling. So that's the first piece of this. Second piece of this is with respect to the nuances across systems. Look, we can put guidance from a state level. We can also put requirements in from a state level. We also recognize that there are some on-the-ground nuances between school districts, communities, and what's happening within even schools within those school districts. In fact, one school what's next to another school in a school district may have a different principles approach to how they're going to take things on. And we want to allow that flexibility. Why? Because schools are so different. Each school system is different. Each school is different, and each scenario of an educator, a student, a classroom, there are so many things that we from the state standpoint cannot regulate. What we can do is to provide the guidelines, and then hopefully and appreciatively, those schools on the ground are then able to follow those guidelines and be successful for what's happening within their school itself, whether it's in the playground or whether it's indoors. So hopefully that helps. And Dr. Lindquist, I don't know if you wanted to speak anything about the pediatric side, and then Dr. Miller, you may have some additional comments.
Yeah, no, I think you've stated it well. I think we don't know the effect Delta is going to have on kids. Everyone is watching the number of pediatric hospitalizations. We're watching the number of pediatric deaths. And just a reminder, that number remains incredibly low. The hospitalizations and deaths remains incredibly low for pediatrics. But my intention is to really watch carefully for outbreaks. As school has come back, as we're testing and having all this structure in place, really watching, are we going to see outbreaks? And if we do, we'll be the first to talk with Dr. Shah and determine new policies as needed. So I'm comfortable in the ability to monitor how this goes as we get back to school. And I agree, one size does not fit all. So we also have the ability to work with every school district where they're at and go through this as it unfolds. And so I'll turn that over to you, Dr. Miller.
Yeah, we have seen really strong compliance. We know there is frustration. We are in a local control state. That is the reality. And in most cases, districts have the authority to do a lot of the decision-making locally that fit the needs of their students and their families, period. In these cases, the commonality across DOH and OSPI and the CDC is that we have learned a lot over the last year about how this virus is moving and trying to stay one step ahead of it. And so we know these layered mitigation will work. Families want in-person learning. We know the vast majority of parents, families want in-person learning. We know these mitigation strategies work. And so far, we have not seen, even though there have been lots of conversations about it, we see districts moving back into in-person learning, have already started school, and are complying with the requirements.
Thank you. Our next question comes from Steve from Como. Steve?
Hi, thanks, Julia. My two questions will probably go to Dr. Shah or Dr. Lindquist. The first one is, knowing the hospitalization numbers tend to lag by about a week or two or so, is there any concern that we will get closer to a crisis mode? How far away are we from that? And how much more strain can we expect on hospitals over the coming weeks? Second question is, I'm wondering if you could talk a little bit about the Delta variant, its sublineages, and the efficacy of antibody treatments. I think in the latest variant report that came out yesterday, it was stated something about, based on preliminary info, some antibody treatments might be less effective against the variant, and then vaccine effectiveness might also be lower.
Yeah, let me take that first stab at the first one. Scott, maybe you can work on that on the second one. And Nate is on as well. And, this is something that we have been working with our partners all across the state, as well as in our healthcare system, including the WMCC, the Washington Medical Care Coordination, the Coordination Center. And I would say a couple of things. One is, Steve, that there have been some terms that have been thrown out there. For example, you mentioned crisis. Some have said this crisis standards of care. There have been some terms that have been loosely thrown out there. We are absolutely at a critical time in our healthcare system, and we want everybody to know that in order to not stretch further, because eventually when you have a rubber band and it stretches, it does break. I mean, there is a point where our system cannot continue to go in the mode of stretching, especially at a time of staff shortages, especially at a time where healthcare personnel, workers, people like Dr. Lindquist, myself, who have actually, who have experienced how difficult it is to take care of patients, but also to do that during a pandemic is absolutely challenging. So it is up to all of us to be able to do the things that we need to do in order to, behind the scenes, make sure that our healthcare system is supported. And that means wearing the mask. That means getting vaccinated. That means staying out of those crowds. That means staying physically distanced. Those things that earlier in, it sounds like we're repeating a message from months ago and a year ago, but we are, because that's exactly right. But we have one tool, which is vaccination. That's the long game that gets us to, but it takes several weeks for that to get the protective effect. The mask you put on, immediately you get that protection. And so these are the things that are in the midst of our work. The planning really has, at the end of the day, been about healthcare and public health and all of our systems working together. We don't believe that we are in a crisis mode yet. We do see that in certain hospitals, certain parts of our regions, and certain communities, it is really stretched, very, very significantly stretched. And what we want to do is to prevent it from going even further, even longer. And as we all know, the longer you go and the more you stretch, you get into the point where you have that breaking point. And so we're not there yet. We certainly aren't there with crisis standards of care, which implies a whole formal set of something else. But what we do want to make sure is everybody recognizes the importance of working together. Nate, did you have a follow-up on that? Otherwise, we'll turn it to Scott.
No, I think that you've certainly hit the high points. I would also just add that this is a national situation. It's not just here in Washington that hospitals are stretched. They're stretched all the way across the country and across our region. And there's a number of things that hospitals are doing right now to create that space and to continue to care for patients. And they're working very closely with a number of state agencies, local partners, even federal partners to continue to maintain their ability to care for people where they need it.
Yeah, and just before I jump into the variants, I want to make sure, we have a bunch of really smart modelers that work for DOH. And one of the things we asked them to do was enter into a modeling the projected hospitalizations over the next couple weeks. And I have seen that preliminary data, and it does not look good. It is concerning, to say the least. Our best hope is that we have a downturn in cases. But again, like we keep saying, vaccinating and preventing ongoing cases is our best chance at protecting the hospitals. But our modeling does not look promising. As far as the variant goes, the question about monoclonal antibodies. Now, this is a technology we have used for cancer treatments. We've used these before. What we are finding is certain formulations of the monoclonal antibodies do not work against some of the variants. What is available currently for Washington State still has efficacy against the Delta variant, so that's promising. But getting access to these monoclonal antibodies has proven to be challenging due to staffing shortages, the ability to have a facility where you can go in and get an IV placed and get this infused. There is one formulation that is a muscle injection where you actually, like a shot, get an injection. That's probably the biggest limitation. And then the other big limitation is these monoclonal antibodies only work if you're within the first 7 days of symptoms of starting COVID. A lot of people wait till they're very ill, well past the benefit of the monoclonal antibody. So what I would encourage everyone is, if you become ill with COVID-19, you have this discussion with your provider right up front, whether you're a good candidate for the monoclonal antibodies. Certainly what's available still has efficaciousness against Delta, including the vaccines still have very good efficacy. Reminder that the goal of these vaccines is not to prevent infections, although we like that it does that. It is really to prevent severe hospitalization and death, which they are very effective against, and still very effective against the Delta variant. So I turn it back to you, Julie.
Thank you very much. Our next question comes from Dina at Bloomberg. Go ahead.
Hi, thank you for taking my question. I have a question on preparedness for booster shots later this month. What's being done in terms of that, of getting clinics ready for that? Are they going to be dispensed at the same places that are currently handling vaccinations, or do you need to up capacity in any way, shape, or form?
Michelle Roberts, who heads our vaccine effort for COVID-19, she's here. So Michelle, this is a perfect question for you.
Yeah, it's a great question. We're doing a lot behind the scenes with our healthcare provider community and to plan to ensure we're ready for booster doses, including ensuring we're ready up at some point to the max number of 90,000 a day of doses that we were giving out at our peak. So right now we're really trying to ideally see if we can manage the capacity within the existing vaccination places, which largely at right now are the pharmacy system, regular healthcare providers, and our mobile vaccination teams. Those will be the primary strategies, but we are talking with healthcare providers, with local health, and really ensuring, is there enough capacity again there? What are the plans? And thinking about if any mass vaccination sites may be needed. But so still working on all those details, and really on booster doses, one of the most important pieces is the final recommendations from FDA and the ACIP on who will be getting booster doses and exactly when that will be happening. But we are planning behind the scenes with healthcare providers and local governments to ensure we're ready.
I will just want to add one quick thing, Julie, to this. Michelle, thanks for answering that. The truth is that we also want to make sure that we're focusing on those groups, not just from a timeline standpoint of 8 months, but those groups that we believe are also more at risk. And that includes, obviously, again, going back to last year, it feels like we're going, almost potentially Groundhog Day, but going back to those in older population, healthcare workers, again, people that we want to protect. And so if you're not in those categories, while you'll likely be eligible still to get vaccinated or get the booster vaccine, we want to focus on those who we, again, continue to believe that are most at risk or most exposed. And we want to make sure to try to focus that, even though it'll be different than it was in the previous iteration of how we rolled out vaccines. But again, more to come on this. Obviously, I just wanted to add that additional element to this. And Julie, the other thing is, I want to keep trying to go through as many questions as we can. How many do we have in the queue?
I was just going to say, we have 6 reporters left in the queue and 2 minutes left in our official briefing time. So if any of our panelists are able to stay longer, I know it would be great if we could accommodate everyone.
I will make myself available for at least a few more minutes. So we'll keep going as fast as we can. We'll try to keep our responses shorter. Sorry about it. That's usually me.
Great, thank you. Well, next we'll go to Ariel from the spokesman review. Ariel, I'm trying to unmute you. How's that going? All right, I'm going to troubleshoot with Ariel. And in the meantime, let's go to Nicole from Cairo Radio.
Good morning. Thanks for staying on a couple extra minutes for us. Parents are really worried as kids head back to school. As Jessamine mentioned, there have been quite a few pediatric deaths. Can you tell us, parents are desperate for this information. Are there any particular ages, underlying conditions, which by the way are not part of the 18 items protected by HIPAA, that seem most prone to these really severe cases? Are these breakthrough cases that are happening with kids? And then my second question, with the numbers getting so bad, if there is not a plateau, if things keep getting worse, are we looking at possible restrictions? And what are the chances that those restrictions could just be for the unvaccinated, as we've seen in places like New York with the restaurants?
Thanks, Nicole. I'll take a stab really quickly at the second question, and then Dr. Lindquist can go to the first question. The second question, I would just say that we've said this before. Look, we've put mask requirements in place. We have vaccine requirements for certain groups in place as well. We're obviously encouraging people to continue to remember that we're in the pandemic and the actions they need to take in order to protect themselves and those around them, and ultimately their communities. So there are many things that we have already done. But what we have also said is that if the trends continue to go in a direction that we do not feel that those measures are enough to mitigate that, as Dr. Lindquist mentioned, then we do need to be looking at other options, and we have been looking at other options. But we're not committed to doing any of those. In fact, we don't want to do any of those. We do hope that our community members do the right thing. For example, wearing a mask. For example, getting vaccinated. For example, avoiding crowds or large gatherings or unprotected behaviors that are going to get themselves, but also their community members in trouble. So that is something that we're absolutely working on. But right now, no plans specifically are in place outside of what we've already done.
Yeah, and I'll just give a general summary of the increase in pediatric deaths. Again, a reminder, this is not even on the same level as death or hospitalizations in adults, but the patterns are very similar. So it is clearly over 90% of our deaths or hospitalizations are in unvaccinated people. Okay, so trying to get a vaccine for this pediatric group is even more important. And then the second thing is underlying conditions play a big role in who's at more severe disease risk. And that are the obvious things like underlying immune suppression, so cancer, certainly diabetes. Some of the other things in the older age group are things like obesity, and a lot of the things we see in higher risk for adults. So underlying conditions, unvaccination are the main drivers of these deaths across the country. But again, we still have tools. Don't forget, for parents, we have these tools that we know work. Things like masking, social distancing, vaccination, all these efforts we have to mitigate the risk in kids.
And I'll just add to Dr. Lindquist mentioned the importance of waiting for vaccination for younger kids. But one of the critical things we can do is ensure that with younger children that everybody around them is vaccinated. So that's one of the reasons the governor put the requirement in for K-12 teachers and staff, including their family members. As a community, we can surround these kids with protection. It's especially important for, as Dr. Lindquist just said, our highest risk kids who we want them to be in school as well. So we can do our part. And Dr. Shaw mentioned the importance of what we're all doing in our private time as well, or our away from school time, to keep our communities safe as well, to reduce the spread of COVID so we can have our kids, including our high risk kids, in school.
Thank you. Ariel from the Spokesman Review would like me to ask on her behalf, do we think the Delta surge will last longer in counties and communities with lower vaccination rates?
Scott, I would just say that I do think that this pandemic rages on, and it rages on especially where the tools that we have at our disposal are not being utilized. And so there's no good to have a vaccine if nobody gets a vaccine. It's no good to have a mask if nobody puts a mask on. These are tools that we have in our toolbox, and they're only as good as people using them. So that's in a general comment. From a Delta standpoint, Scott, it really is that, we still have enough, while we have done we're one of the top states when it comes to vaccinations across the country, but that does not mean that we still have enough people out there that can continue to spread this COVID Delta variant because they're just not vaccinated. And so I do think it can last longer in those communities. We've said before, we do not want to see a tale of two societies. Unfortunately, we're starting to see that. Scott, anything to add?
Nope, perfect.
Thank you. Our next question is from Jake at King. Go ahead.
Thanks for staying on a few extra minutes, everybody. We appreciate it. Quick question. Have we been able to see the results of the full FDA approval on our vaccination rates? And Scott, this is a question for you real quickly. Is the rounding off that you're seeing with the cases right now, is it safe to say that, we know that contracting the virus provides some sort of immunity. We know the vaccine provides some sort of immunity. Are we getting to that herd immunity stage that you've been monitoring? Thanks.
You want to go first, so we can, Michelle?
I do not. I'm not a big fan of the word herd immunity. What we're really talking about is getting enough antibody protection in the community to prevent the transmission of this virus. This virus is 40% more infectious, so we actually have to drive those numbers higher. So no, we are not near that yet, as evidenced by the fifth wave. So I'm very concerned that we're going to have a hard time reaching that. And we do know that through some of the studies that even natural infection probably is not as good as natural infection plus after you're recovered getting a vaccine series. So we still have quite a bit of work to do. And I'm not sure where this rounding off is going to go. I'm hoping it's going to go to level and then downward, but that is pure conjecture at this point.
Yeah, and I'll just add that our most recent modeling report always includes, the modeling reports include an estimate of that are available on our website, includes estimates of overall community immunity based on both vaccination rates and infection in our state. And as Dr. Lindquist said, we don't really know about long-term protection fully, but we are still only about 55% in those modeling reports is the estimate for both vaccination and disease as in full protection. So that is a long ways for most diseases for stopping the spread of disease.
Great, thank you. Our next question comes from Eleni at KXLY. Go ahead.
Hello, thanks for giving us a few extra minutes. I actually have a few questions. Mass testing, the health district in our area in Spokane says that it's asking the state for help with mass testing. Where are you guys with that? And then the second question is, we are in worse shape than we were when we were in the phases to reopening. Is it possible for us to go back to that? And why or why not?
Thank you, and yeah, you took up all the questions that your colleagues have. I'm just kidding. Thanks for those. You know, again, we're at a different phase, different time. We have tools. We're doing everything we can to make sure people are utilizing those tools, and if the situation warrants that we have to take additional steps, we're prepared to do that. But obviously, we also recognize that we want to keep our economy open. We want businesses to be able to do what they can. And we do think that there is going to be a point, and we're already there, where you can do both, where you can stay open, but you also can have an eye towards health and protection. And so we're going to have to be living with this virus for a long time, and that's why it's really important for us to do those things. Nate, did you want to mention anything about the testing? I don't have, on the Spokane question, I don't have visibility on that request.
Yeah, so I don't have specific visibility on the Spokane request, but what I can say is that due to some supply chain constraints and overall demand for all the testing right now, many communities are facing some challenges in getting the number of testing supplies that they're hoping for. In this, you know, we are working with a number of different vendors for testing supplies, as well as communities, to try to make sure that we're getting as many testing supplies to folks as we can. But this is again one of those impacts from just nationwide increases in COVID, and also just some other issues that have affected some of the testing supplies. So we're well aware of this occurring in many communities, and are really working hard right now to bring in additional testing supplies to the state through a number of different sources to make sure that we can continue good testing, because as Dr. Shaw mentioned earlier, really that's the key to identifying a case. That's the key to helping prevent the spread of COVID in the community. So that's what I have.
I would just add, we have, as was mentioned before, we have over 300 school districts, tribal compact schools, private schools participating in the Learn to Return. If the question is about how to get access to the information to get started around that, that is something that we've been putting out lots of information about since the spring, and can definitely help a school district that wants to engage in that program. Happy to do that. As Nate said, though, if it's more about they're in the program and they're having challenges, that's something to contact the Learn to Return point folks on.
Amanda, did you have anything you wanted to add on that one?
No, I think it's been very well covered, and we know that there are a lot of resources available. So working with the Learn to Return team is going to be the way to go. Thanks.
Thank you. We have two reporters left. Our next is Dennis from Cascade Public Media. Go ahead.
Hi, thanks for staying a little extra time. I really appreciate it. My questions are about the school district staff vaccine mandates. I was wondering, how will the state be monitoring the school staff vaccine mandate? Is it going to be self-reported and self-monitored by the districts? And is there any concern about possible staffing shortages due to this vaccine mandate? And if so, is there a plan or guidance for school districts?
So I'll take that. Thanks for the question. We have, in the last couple of weeks, put out forms for exemptions for those, knowing that the requirement goes into place October 18th, similar to state workers. So we actually have a parallel process here with state agency requirements, as well as K-12, higher ed, and early learning centers. So there's a wide swath of folks that are in this requirement. School districts have the tools with a Q&A, guidance, and exemption forms to follow the process of accommodations for staff that choose that option, go down that route. We will have a data collection system through our office eventually, but that probably will not kick in, obviously, until after the October 18th deadline. But we will be tracking this, not at an individual level and not collecting medical information, but just knowing the general information about vaccinations across the state. School district offices, though, school districts themselves are responsible for administering this through their HR offices. So every HR office in a school district, they are the employer. They will be actually doing the required paperwork with the vaccine verification, as well as any exemptions.
And our final reporter. Oh, go ahead.
Yeah, I think you had a second question about staff shortages. We are tracking that very closely. We have had meetings with both school superintendents, fielding phone calls. It particularly might be acute in our school, in our bus driver, in our core of bus drivers, which before the pandemic was a place of concern in terms of staffing. So this is just another added layer of concern. So we are looking at all options to support school districts in that, have gotten briefings on the certification process for that, are tracking this very closely with our school districts to know where are the problem areas and is there anything at the state level that we can do within our framework for certification and licensure to help school districts as they get closer to that October 18th deadline.
And Julie, I'll just add to Dr. Miller's comment that we're also mindful of concerns that are in the healthcare system in a similar way of healthcare entities saying that they're concerned about the requirements and staff shortages that may result. We may not be able to track it as closely as Dr. Miller's team is for schools, but certainly it is something we are aware of. We're obviously mindful of the importance of vaccinations, and that's why those requirements are in place from a healthcare worker standpoint. But I do want to just acknowledge the fact that we're hearing similar, at least some discussions in the healthcare system as well.
And our final reporter had to step away, so that concludes our Q&A segment of today's briefing. I'd like to go back to Secretary Shaw for closing remarks.
Well, thank you. First of all, I want to thank Dr. Miller for joining us. As you can see, she's absolutely the right person to be a part of the conversation today. And I do hope, wait, we just got a message from Jake Wittenberg. Julie, is he trying to ask a question?
Oh, I apologize, Jake. Could have sworn I called on you, but let's take Jake's. Let me pull this up, and we will wrap up with Jake. Stand by. All right, Jake, take it away. Jake, can you hear us?
Can you hear me?
Yes.
Hi, sorry, this is not Jake. This is Angeli.
Okay, I was looking for your name. Thank you for getting to the bottom of this.
Two reporters from King. So when you called Jake, I was like, I think I don't know if he's on anymore, but
got it. Thank you for clarifying.
Thank you everyone for staying on for this last question. I'll make it quick. Is there a concern that long weekend travel could lead to a spike in Washington with the Delta variant? It didn't seem like there was a spike after Memorial Day, but the state wasn't fully open at the time. But with more hospitalizations and cases that you've been talking about, is there more or less of a concern than Memorial Day or July 4th? And what's the message to people?
Yeah, so absolutely. I think in a short answer is yes. A long answer is yes. We are concerned because anytime you have holidays and you still have a pandemic that's raging and people want to enjoy themselves, rightfully so, we just want to make sure that people are doing it with the mindset that we're still in the midst of the pandemic. And so yes, after, we know in general in this pandemic, it's usually 10 to 14 days, couple 2 to 3 weeks later that you see the impact. Delta variant is also important into consideration, which, and the state reopening, as you said, rightfully so, Memorial Day weekend and even 4th of July was early in that process. And so this is going to be really important for us to keep monitoring. And then obviously with the confluence of schools reopening as well. And so that's why the message earlier to everybody is that Labor Day is coming. We want to make sure that you are remembering that there are things that you can do to help, in this case, our schools remain open and our kids not get in trouble by doing the right things on the weekend. That's going to remember and remind everybody about health and safety. And it also is important for us to be thinking about that message as people consider travel plans. If you are going, and this is, I'm still on many groups and very much aware of what's happening in other parts of the country, including Texas. If there are places that you are planning on traveling where you have seen either because of the impact because of the storm that we talked about or because of the pandemic, we want to make sure that you're thinking about your plans and curtailing those plans, and where you don't have to get on air travel and you can drive somewhere and be somewhere outdoors. These are the kinds of steps that parents and community members can take. Again, we want to make sure we're doing everything we can to be protected during this phase. And Scott, I don't know if you had any specific comment about Labor Day as well.
Yeah, it's really the biggest concern I have, aside from everything Dr. Shah talked about, is risk. So if you are going on vacation this weekend doing risky behaviors and you get in a boating accident or a car accident or a motorcycle accident, our emergency rooms, our intensive care units are so full that I don't know how to say this as clearly as possible. Please mitigate your risk this weekend so that you're not put in a place where you need to try and access an already to capacity healthcare system. So that means for me, I'm not going to go away for the weekend. I am not going to go water skiing. I can't water ski anyways, but I'm not going to do things that are risky behaviors because the backup for that safety net is so strained right now.
So for the record, I'm also not going to water ski this weekend. I just wanted to make sure that was clear as well. And with that, thanks for that last question. Let me go back to closing and just say thank you again to Dr. Miller. As you can see why we invited Dr. Miller today. She's the perfect person to carry the message and also provide a really important factual information on what's happening in our schools. So Dr. Miller, thank you for joining us, and we really appreciate the continued partnership with OSPI and obviously our education partners across the state. I want to thank our team for helping answer all these really challenging questions, and I certainly want to thank all of our media partners for being on today. Ultimately, I want to thank Washingtonians and our community members for what they're doing. It's a very difficult time. We know our healthcare system is strained. We know that transmission continues to happen across our state. We know that certain mitigating factors have been put in place, including both vaccine requirements and masks. But ultimately, this is about everyone playing their part. Whatever you can do to help us, not just for schools, but beyond, to make sure we can stay open, stay protected, stay safe, and stay healthy. That's what we ask all of you to do. Labor Day weekend is coming up. Please do everything you can to stay protected and protect those around you. And ultimately, also the best way you can support our healthcare workforce and our education workforce is not just by saying thank you, but I do agree we need to thank them for everything they've done, but it's to also honor them. And what that means is to be respectful of whatever you can do to play your part to keep our communities safe. So please wear your mask, especially indoors, but even in crowded settings or outdoors in many instances, and certainly get vaccinated. So with that, thank you so much. Really appreciate this. And Julie, we'll turn it back to you to close.
All righty, that concludes today's media availability. Thank you very much and have a great day.